Antibiotic resistance can lead to higher medical costs, prolonged hospital stays, and increased mortality. At Pomona Valley Hospital Medical Center, we spoke to Dr. John Mourani, an infectious disease specialist. We asked him to tell us what antibiotics are and their proper use.
Antibiotic is a medicine that we use to kill mainly bacteria. It does not have an effect on viruses or fungus. So this is specifically for bacteria. Strep throat, pneumonia, these are very common bacterial diseases. At the same time, you have also tuberculosis, gonorrhea, so the spectrum is very broad. It would not work for a common cold. Common colds are caused by viruses, and actually antibiotic would not be of any value.
How long do antibiotics take to work on a bacterial infection?
There's many classes of antibiotics, and they work differently. And you would expect to see a benefit if you have a bacterial infection within 2 to 3 days, and then you'll have a better result when you finish the course as prescribed, which may take 5 days or a week, depending on your disease.
Dr. Mourani explains the dangers of antibiotic resistance.
Antibiotic resistance is one of the biggest global health threat. Not only in the US, again, it's globally. Here in the United States, we have approximately, as per CDC, around 2 million people get infected with resistant organism and around 23,000 deaths a year. Commonly, people do go to the doctors with common cold and symptoms of infections that do not need antibiotic, but they do want an antibiotic, they demand antibiotics. And that's always an issue. They may not be satisfied with the doctor's answer that they don't need antibiotics, but really listening to the doctors in these kind of scenarios is very essential. If you're starting on outpatient infection, that you're getting oral antibiotics, and at some point don't work, you may end up in the hospital. You may end up hospitalized for simple things because the antibiotic won't work, and you require intravenous antibiotics. And every time you're in the hospital, you're higher risk for getting hospital-acquired infections and more complications. You may end up needing antibiotics that have high risk of complication and side effects than simpler antibiotics.
Taking antibiotics as prescribed is crucial.
Avoiding using antibiotics is probably the best advice, but sometimes you need antibiotics. So really the best person to give you this advice is your healthcare provider, your physicians, and you gotta listen to them and do not demand antibiotic if they feel that you don't need it, and finish the course of the antibiotic that's prescribed. Hand hygiene is very important. And another good tip is not to take any of your leftover antibiotics. Those should be discarded appropriately. And whether these your antibiotic, you've taken them before, or your other family member, you should not take them. Again, go back and check with your healthcare providers. He's the best person capable to decide if you need antibiotics or not. This is probably how you do your part in cutting down on antibiotic resistance.